Nurses at the area's only level 1 trauma center are now without a contract.
Albany Medical Center failed to reach an agreement with its nurses by the time the contract expired last night. Stella Porter's here in the studio to talk more about what happens next. Stella, good evening. You spoke with both sides on this.
Hi, good evening, guys. Both sides have agreed to bring in a mediator now. They've been negotiating for several months. Nurses spoke up today about the issue they say both sides disagree on: staffing. The Department of Health investigated Albany Med's staffing back in June, but it has yet to release its report. The New York State Nurses Association ties long wait times reported at the hospital directly to high turnover of staff. One nurse tells me there are hardly enough experienced nurses to train the new ones starting.
He asks me why I stay. I stay because the population of patients that I take care of only comes here. And guess what? They need nurses like me here to take care of the patients, and they need to do something to keep the experience at the bedside.
Albany Med CEO Dr. Dennis McKenna answered our questions today. He says wait times are improving over last year. He says the hospital's staffing for nurses is net up over the past year, but nurses say the issue is that experienced nurses are leaving because of poor conditions and low pay. I asked him about retaining experienced nurses.
The contract proposal that we put in place not only recognizes increasing base salaries for new nurses, but it also recognizes the experienced nurses here and would make significant adjustments to them as well. That professional pathway development for our nurses is important for us.
And that mediator could take about a week to come in. Dr. McKenna says it's not unusual for nurses' contracts to expire, and he says he's confident they'll come to an agreement. Guys, back to you.
Stella Porter here in the studio. Thank you very much.